Hello, everyone, and welcome back to the Agency Advantage. Today, I'm going to talk about what it's like to work in corporate, specifically by a large biopharma company. And this is especially important for people who want to kind of pivot career from, say, academia, other small companies like agencies or contract research organizations, maybe medical doctors, pharmacists, people like that who really want to try and get a job in biopharma. Spoiler alert, it's not quite what people think it is. And I hear lots of people say to me, I can leverage my experience. I've worked with lots of clients. I worked for a big company, but until you've actually worked in corporate, you cannot imagine what it's like. The politics, the negotiation skills that you need, the volume of people that you're speaking to. I want to get into what that actually looks like in a pharma company. Ultimately, it's the same whether it's a pharma company, whether it's a big corporate, tech company. It's corporate, they're all the same issues and all the same challenges. So this kind of applies to anyone who works in corporate. Essentially, when you work in a big corporate company, you have these individual teams and they all work in their own kind of very defined swim lane, which is great if you're new to doing a job, because then you get to know how to do this job really well. But I think it's really hard to realize that there's very little interconnectivity between these swim lanes. All right, so for those who are listening on the podcast, I'm actually showing everyone, you can check this out on YouTube, an example of a global team. There's even more layers than this, because in these huge, large pharma companies and biotech companies, they have the global kind of team that sort of sets the strategy, tone, visuals, branding, and everything like that. Then you have your local offices, so your local affiliates or local countries. And they apply this kind of global strategy to their local market. So there's even more layers to this, but just for simplification, I'm taking you through what a global team and a few of the departments might look like. So I have access, and they will do the submissions and work with the local regulatory submissions. They'll run specific trials as well related to ensuring that there's reimbursement of these therapeutics in the local market. There are many things that access team will do where you have to work together with, say, for example, medical affairs, scientific communications, the commercial team. So there's many ways that you have to work together. What's really surprising for people who work in an agency or smaller company and then come into pharma is the fact that you can approach these people, but unless there's a forum, so that could be some kind of work stream or kind of some kind of set meeting, you have your very defined roles and they'll have their very defined roles, and your priorities will not be the same as the priorities of that team. Your priorities need to align. You need to negotiate a lot of build a rapport with certain people. That's the best way of working together. So this relationship building, negotiation, all of these things to consider. And then another one of these streams is the commercial team, and they're involved peri-launch. So they're working on the promotional materials, they're working on the commercial strategy, the materials that the sales representatives use, forecasting, all kinds of things. And these are some of the roles you'll see in a commercial team. If you're a commercial lead, you're a competitor intelligence person. It depends on the company. Sometimes these different roles sit in different structures, but this is just an example. There might be a brand leader or a marketing lead or a product lead. It depends whether it's a big pharma company or a big device company. And then you might have an insights kind of manager who's kind of doing the market research. And then another one of the streams is medical affairs. And medical affairs really are involved much earlier than commercial, from phase 2 onwards. This is where you're kind of early on, you're kind of building the medical materials, the medical strategy. So this might be around diagnosis. If it's a rare disease or where there are limited treatments, it might be creating a strategy and medical education around diagnosis, recognizing the disease in the first place, so, symptoms and things like that. Medical affairs will also kind of work on, obviously, the data presentations, medical materials around the data, as well as broader data in the community. Medical affairs also works on early access programs, working with the clinical sciences team to deliver the pivotal trials. And sometimes scientific communications and publications will sit under medical affairs, sometimes they won't. So you'll have your medical lead, your medical scientific directors or leaders. Then you might have scientific communications and publications under this medical affairs umbrella. It really depends. And even some companies have somebody who's dedicated to kind of patient materials and patient education, and they might sit under medical affairs. And then you have your clinical development team. Your clinical development team are obviously involved at the minute you're considering doing inpatient trials. They will be responsible for working with experts in your steering committee to develop the protocols, to run the clinical studies. Within that team, you'll have somebody who's the development lead and then somebody who's a medical monitor. Typically, it's someone who's got a medical degree. Then you'll have somebody who's a study lead. So they will be very close to the protocol, like data collection. And really they're the go-to person who kind of knows all there is to know about the study. Then you'll have a biostatistician who is involved in collecting and analyzing the data. And then there's also regulatory affairs. I've realized that the one I'm showing here, there's a typo in regulatory affairs. So there's a regulatory affairs team, and then you'll have a regulatory lead and the filing lead. There might be other roles as well, but that person will be responsible for preparing the regulatory filing package for FDA, for EMA, for the different bodies. It depends on whether they're global or involved in the local regulatory submissions. These are some of the main departments, but there are many other departments, and your level of interactivity with these departments will really depend on what you're trying to achieve. So some deliverables like publications, it might be really clear that there's a very clear SOP. There'll be an internal SOP, but there are also very clear external kind of like GPP4 and other kind of guidelines that dictate kind of how you conduct working on publications and who can be involved and who can't be. So that's a really good example of something where it's really clear. You'll have a biostatistician author, you'll have a clinical science author, you'll have a medical affairs author possibly. And there's a very clear process where the medical affairs person will be involved in reviewing and signing off. This is an example of a project that's very clear cut because there's very clear kind of outline of who qualifies as an author, who then reviews, and there are certain steps, and typically they go in data vision. Where it gets tricky in corporate and in pharma is where you have these cross-functional projects. And what I mean by that is where you have a project where you need to get input from multiple people. A good example of this could be a narrative of some kind. Let's say you are new to a disease area and you want to develop a narrative. It's typically an internal document that everyone has, so we're all speaking with the same voice, but the result of that is external. The execution of that is external. So, and a good example, let's say we really want to we're moving into a new disease area. We need to have a narrative for diabetes. If you think about the audience of that narrative, it might be patients, it might be layperson, it might be media, it might be investors, it might be GPs, it might be endocrinologists. So there's many different audiences, and that might dictate internally who you would then work with to deliver that project. That might mean that you have to get involved. If you think about who's dealing with the lay audiences and media, that would be external comms, which I haven't actually talked about, but that's sometimes sitting under commercial, sometimes it's sitting under its own, group. Because I mentioned patients, do we get the patient engagement manager involved? I mentioned HCPs, both GPs and endocrinologists, that would sit under medical affairs or maybe even clinical development as well. Depending on the audience, you kind of reflect that back internally, like who is working with these audiences and who then needs to have both input and oversight of this project. It's possible that you could try and do this narrative just within one department, like maybe medical affairs takes it on, But it will be very difficult to get endorsement internally, and it will be very difficult to actually get people to use this if you don't bring them into the fold and kind of get their buy-in, their input, if people feel like they're contributing in some way, then I think it's just much easier to get them to actually get behind something and use it and be really enthusiastic about it and then share it with the colleagues. If you bring them into the project. So there's a little bit of massaging, a little bit of ego. I'd really value you to come into this project. It's very much about sort of negotiation. It's very much about, because you're negotiating with their time. Like, why should I be involved in this time-consuming project? What's in it for me? There's all sorts of interpersonal relationship building that come into these projects that I really just don't think people appreciate when they're coming from agency. Yes, you do client management, or any other company that isn't corporate. You're doing customer facing. You have to be nice and polite, but this is different. This isn't about people pleasing and being nice. You urgently need to deliver this project. It's more about finding that common interest between, say, someone in medical affairs or someone in commercial, then tapping into that to convince them they need to be involved in your project and they need to be kind of contributing and reviewing or inputting or accountable in some way. So it's actually really complex. People who move into pharma, if you're not somebody who's good with people skills, there are roles that you can do, like say if I think about the color wheel, I don't know, maybe I'll just briefly go through the color wheels. So there's a blue personality who's somebody who's very much very detail orientated, prefers to kind of like be isolated and read things, more task focused than people focused. And on the other side of that, you have a red person who's very task focused. They're not detail orientated, they're big picture, but they're very forceful and just like to get things done. And they can be perceived as quite bossy, but they're not necessarily deliberately bossy. They just really want to get projects through. Then you have the people who are more kind of people focused. So you have the yellow personality who is a real ideas generator, somebody who has lots and lots of ideas, is quite creative. Yeah, they're very into people building, relationships focused. Then you have green, who tend to be more introverted, quiet, contemplative, very people focused, relationship focused, and they are driven by emotions and justice, making sure everything's fair, great for team building, but maybe not so good for decision making. If you look at the color wheel, those are the color personality groups. If you're on the blue side of things, then working in biostats, clinical development, regulatory possibly because it's very formulaic, those could be really good options. If you're more creative, leaning towards the red or yellow side, then maybe commercial, medical affairs, or even access are quite good options because they're a little bit more creative, strategic. So yeah, I think it's really important to sort of know what personality you have. So if you're really trying to get a biostats person on board with your project, you might think about changing your approach so that it's very fact-based. It's not about kind of touchy-feely, being super friendly, being, team focused and things like that. It's more factual. It's more about the data. It's more about the timelines and things like that than you would potentially with a commercial person where you're more, what will the impact of this be? How will it make people feel? How will it make them change their behavior? That kind of thing. So in a nutshell, that is what the global team looks like. Obviously, this is just a very small proportion of the functions involved in global. There are many other functions like support functions, which I'm not showing here. There might be project managers who sit in medical affairs, commercial. It depends on the team. There's many different functions and many different people working in global. And I haven't even gone into the affiliate. If you think about, we all have multiple projects. You might have a narrative project, several publications projects, a few trials. You might have some medical education, and they will have different people that need to input. You'll have more creative projects where you might need to work with commercial. You have other projects where you might need to work with biostats or clinical sciences. So it really depends on the project. And every day you're interacting with a huge volume of people. It can be hundreds. And this is something that I think is underestimated by people who are trying to find a job within biopharma. I have some tips. There are obvious things that you need to do in order to convince the hiring manager that your skills are better than somebody else who's got experience. But I think one of these is sharing that you have these transferable skills. I can project manage, I can manage a budget, I've done pitching so I can present. I understand the data because I've worked on this disease area. I know your pipeline, all of these kinds of things you can do. And my values are aligned with your values. One of the really important things, I think, is to be humble and acknowledge the fact that you haven't got this kind of corporate matrix cross-functional working experience, but that you understand what's involved and you've done your research. You can talk a little bit about, okay, I see it as very important to have these interpersonal skills, negotiation skills. You're managing multiple functions. You're interacting with many people. I think it's just to acknowledge that you understand how it works and that you're prepared and that you have these interpersonal skills to navigate that matrix environment. That's what you're going to need to do with the hiring manager. In a nutshell, that's how corporate works. What I haven't spoken about is the internal politics. In corporate, most people are really nice, but not everyone is there for you. They have their own agenda, whether that agenda is just, I need to execute these projects in my team. I'm not interested in other external things, or more sinister, like I'm interested in my career, promoting myself at the expense of other people. And there will always be people like that. But I think in corporate, this may be a bit of a stumbling block, because if you're working with people like that and you're trying, and you need their input, you need their buy-in, and they're thinking of other things or themselves, it does make it very difficult because they can actually put a stop to your project. It can be really time consuming to convince those people. Try to tap in, almost using behavioral science in a way, like tap into what it is. Maybe promotion is the way to reach that person. Like, oh, this project is going to be really seen very importantly by the leadership team, and you'll be a prominent person involved, and obviously your name will be on it. And that might be tapping into their ego, the way to kind of get a project through. There are structural things that make working cross-functionally difficult, but there are also personality challenges as well. In a nutshell, that is corporate, and it's not for everyone. And that's okay. We're not all the same. I can understand why many people get quite tired of working in corporate. I see it as an exciting challenge. Like, can I win this person over? Can I get them to, collaborate with me? That's a challenge that I really enjoy. So I think there are some positives in it. I hope you found this really helpful. I got the diagram that I'm showing, that obviously you can't see on the podcast, from my ebook, which you can download for free from my website. So please take a look at that. It's called the Agency Advantage ebook, and there's an accompanying workbook as well. So yeah, have a look at that. There's lots of really helpful information about how pharma is structured. Go and download a free copy and let me know what you think. Thanks so much for listening, and don't forget to like and subscribe if you want to hear more content on working in pharma, pivoting your career into pharma, and biotech and pharma career advice.